Hello everybody, my name is Mervyn Morgan. I'm from the ITP Support Association here in the United Kingdom. I'm going to talk today about something we're very proud of at the moment. We've recently published a shared decision-making toolkit for ITP patients entitled Making the Right Choices in ITP Management and Care. You were probably asking, what is shared decision-making? Well, shared decision-making is a joint process in which a healthcare professional works together with a person to reach a decision about that person's care. It involves choosing tests and treatments based both on the evidence, on the person's individual preferences, beliefs, values, and their lifestyle. It makes sure that that person understands what risks, benefits, and possible consequences are of the different options through the medium of discussion and information sharing. Now, the objectives of our toolkit are twofold. Firstly, we aim to empower the patients through updated educational materials, which includes patient information, treatment options, and holistic support. We also aim to improve the treatment and care for patients via refined processes around collaborative decision-making between the patient and the clinician for the treatment and care plans. Now, this document was created after we set up a ITP Working Group, and the working group was made up from representatives from two main partners. That is the ITP Support Association, which as many of you will realise, the association operates in the UK and Ireland and aims to promote the general welfare of patients and the families of ITP patients. The ITP Support Association's patient information resources are freely available both for ITP patients, their families, carers, as well as the medical professionals and researchers. And we help to provide advice and literature on how best to deal with this condition, helping people better understand ITP. And the ITP Forum, or as its other name, the ITP Clinical Forum here in the UK, is a working group of healthcare professionals with a special interest in the care of patients with ITP. These two bodies came together and formed the ITP Working Group, which is a multi-stakeholder task force involving patient advocates, i.e. from the association, patients, i.e. from the association, healthcare professionals and health policy makers, mainly from the ITP Forum. The group was established in 2020 and it seeks to identify the challenges associated with delivering optimal ITP management and care in the UK and provide guidance and solutions to them. Now, there's various stages with the ITP toolkit. The toolkit was developed in response to the ITP Support Association's 2020 patient survey, which provided evidence of inconsistencies in the diagnosis and management of ITP, which had an impact on patient outcomes. In October 2020, the ITP Support Association convened a policy roundtable meeting, and out of that came a document called Understanding the Challenges Faced by Patients with ITP. The roundtable identified that enhanced shared decision-making on treatment and care issues is important to improving the quality of life for ITP patients. A working group was established to ensure the smooth preparation of the ITP toolkit, specifically to focus on developing educational materials for patients, carers and clinicians. Other biopharmaceutical companies and professional bodies such as the Genetic Alliance UK and the Royal College of Pathologists in the UK have endorsed or supported the promotion of the toolkit. 3 workshops took place with roundtable members to agree the best practice guidance for shared decision making and the scope and design of the patient-based or the patient-focused toolkit. The toolkit was prepared so that it could be publicised during ITP Awareness Week in September 2021 to patients, their families, as well as healthcare professionals. A link to the toolkit can be found on the ITP Support Association website at www.itpsupport.org.uk. And if you would like a hard copy rather than a download copy of the toolkit, please email your details to info@itpsupport.org.uk and we will send you a hard copy. Now, the working group, as I've mentioned, it was made up of various members of the ITP Forum and the ITP Support Association, both board members and patient members as well. And these are the names of the people involved in that working group. What is the structure of the toolkit, you may ask? Well, basically, the structure of the toolkit follows this pattern. Information about ITP, the understanding of the condition and the importance of shared decision making, the best practice in collaborative decision making, which facilitates itself into a step-by-step guide, and further information about treatment options and other patient resources and additional options. Now, it's broken down into 4 main sections. Firstly, we've got section A. The toolkit offers information on what is ITP and how an individual may become affected by this condition. As you can see from this screen grab from the actual toolkit, it's quite detailed, but it gives the reader a good understanding and a good grounding in how an individual may become affected by this condition. Section B, understanding the importance of shared decision making. Now, as we said, this was one of the key areas from our patient perception survey, and the toolkit offers a definition for collaborative decision making, i.e. decisions over the treatment and the care of ITP should be a bilateral process between patients and clinicians. This allows the patient to gain knowledge, skills and confidence over their condition and treatment options. On the other hand, clinicians can tailor the treatment and care around the needs of the individual, improving prescriptions and the quality of life of the patient. Moving on, section C, as I mentioned, best practice guidance, step by step. As you can see from this screen grab of the flow diagram that is within the toolkit, basically it provides the guidance from the steps that should occur from the diagnosis of ITP right the way through to the choice of what is the best treatment options for that individual. And then section D, further information about ITP. The toolkit explains the different types of treatment that are available for ITP, providing guiding steps for patients in choosing the best treatment that suits the individual's lifestyle. Finally, the toolkit offers links to useful information that the patient can read to further their knowledge on the condition, including links to patient booklets, patient treatment options, and much more. As I mentioned earlier, at the time of the launch, we had endorsements and support from the Royal College of Pathologists and the Genetic Alliance UK. In addition, in the last week or so following the launch, we've now had confirmation that the toolkit has been endorsed by the Royal College of Physicians, where they've given their endorsement to the clinical aspects of the toolkit, and it's also been endorsed by the British Society for Haematology. So we're very, very proud of that. And this page, that is a screen grab of the cover of the document, and that is a link there. But as I said previously, to download the toolkit, just go to our website at www.itpsupport.org.uk and you'll see it on the first page there. Just click the link and you can download a PDF copy. Or if you do want a hard copy, or you would like to order hard copies for your hospital, please email the details with the postal details as well to info@itpsupport.org.uk. And I hope you find the document useful. Thank you very much for listening. Thank you.